Good evening and welcome to this edition of ICS News. I'm Wang Dong. Drug dispensaries such as hospitals and pharmacies are adopting new prices for more than 300 products on a national list of essential drugs. The prices of nearly half of commonly used medicines will fall by an average of 12%. Reporter Chen Ningjie takes a look at the new policy and whom it may affect.
Dr. Lin Dingsheng is the chief pharmacist at this downtown community health center. He received a brochure from the city's pricing supervisor on Tuesday explaining the latest drug prices. Based on the information, his health center has adjusted the prices of around 160 drugs. Under the new national rules, community health centers will be major users of essential drugs. Dr. Lin says the price reduction will not affect his center's operations.
In fact, it doesn't mean any change for us. All our expenses are covered by the fiscal budget. In return, all our income is also submitted to the government.
Residents are not sensitive to the price changes either. Doctors say that is because the city's medical insurance program covers 80 or 90% of the bills if residents buy drugs at community health centers.
I'm not feeling any price change. I do know about the new essential drug list, but I don't know specifically what drugs are on the list.
Patients and hospitals are not feeling much change from enforcement of the new essential drug lists, but pharmaceutical companies are now under a great deal of pressure. The new policy could push some of them to the edge of survival. Officials from the Ministry of Health estimate of the 4,600 pharmaceutical companies nationwide, 20% could go bankrupt due to the new policy. Industry insiders say that figure could be conservative. The start of enforcement of essential drug prices on Thursday is just the first step. Following that, each provincial administration on the Chinese mainland will hold bidding meetings when companies will compete to produce essential drugs. Failure to win the bid means a company will struggle to survive if its manufacturing only focuses on commonly used drugs. But medical experts say even if a company wins the bid, it won't necessarily profit.
As far as I can see, competition for the bidding will be fierce. Profit margins for the bid winners can be very slim. That will require companies to further lower their costs and improve their production efficiency. In addition, it's still up to doctors and patients how well the drugs can sell.
The essential drug list will be revised every 3 years. It is part of the country's medical reforms to lower residents' medical costs. According to an earlier report by the state-owned Xinhua news agency, the disposable income of Chinese residents grew close to 20 times over the last 2 decades. But average medical costs surged by more than 130 times over the same period. Chen Ningjie, ICS News.